Assalamualaikum and very good morning, afternoon, and evening to all of you. Welcome to the second part of the virus and Malay medicine. Okay, ladies and gentlemen, before I proceed with this video, from last video, we already talking about where's my source of reference or studies when I want to talk about Malay medicine and virus. And also I'll show you the list of books, how we want to do it. Okay, and also I touched a topic regarding how the medical researcher back then or those practitioner found out about virus, not really about virus, what's the impact of the virus on human body. Ladies and gentlemen, for the last 20, for the last few hundred years, there is no study regarding the bacteria or regarding the unseen. So what they do is right now, they do the observation of the impact of the environment for the human body. And from there, they started to find out that certain criteria or certain bad air or water or touch can create illness to human body, to human being. Ladies and gentlemen, when looking at patient point of view, we are looking at what's the impact of it. And from their studies and from their all the compiled case they already have for the last maybe few hundred years, and that shows this pattern. There's problem with the air, there's a problem with water, there's a problem with something you touch. And here, what I want to find out, I will tell you about what they do for that. Remember this day, old days when people are using like turmeric or using something like herbs that people can eat for the patient to heal themselves, especially when we're talking about fever, we're talking about some cough, or those are some viral infection, what we see right now, some viral infection or bacterial infection. During my study, I found out that something's quite interesting. Yes, it's a very interesting how the medical practitioner last time uh, do how to purify the air around us because they notice there's some pollutant or some harmful pollutant in the air that can create illness to the patient. So what they do is right now they burn incense. Yes, incense, or in Malay what you do is they burn kemian. So the smoke of the kemian coming up and it create a this kind of smell in the room. It's not just that. Even from the Arabic, they use lots of incense into purify in their room, and also in treatment together, the in treatment place or in their house to do it. And also for the Chinese, also do the same thing. They have incense, and from the Indian also have incense. Both of them, all of them, actually not both of them, all of them have the same uh, medical benefit. One of this is right now to reduce stress and anxiety. Of course, we know that when the patient is stressed and the patient are in anxiety, their rate of healing is a lot less. So by using incense to reduce the rate, to reduce anxiety and stress, you'll be able to help the body to cope better, to heal better. One. Number two, the incense itself also is good for the mind because it boosts the signal of the mind. It has some creativity, so we have mental focus and you have a better sleep. So those are the three things that's directly for the focus, for the healing of the healing of the patient. And last but not least, which is much more important, the incense help to purify the air around the room. So in such a way, it will help them to reduce the pollutant, to reduce the, or say, the harmful bacteria or virus or even fungus in the air so the patient can recover better. Ladies and gentlemen, those medical practitioners, we're talking about 800, 400, 500, 600 years ago back before the invention of microscope. Before the invention of MRI, before the invention of X-ray, they can identify it. To be honest with you, even virus itself was only identified as the one of the pollutant in the air or in the pocket, but only about 900 in the 1900th century in the modern medicine, which people can see through the microscope, or not just microscope, electron microscope, they can find it. So back about 1,000 years back, there's no such facility. However, from the observation of patient, they find out that happening. They will can see and they can conclude those pollutants are real. Ladies and gentlemen, if you look at another thing, that's not just an incense. Regarding when we are talking about the basic of what they do in Malay medicine. This Malay medicine, in general, what they do, they have two strategy. Strategy number one, they want to reduce the number of the pollutant, meaning all the harmful item. In our case, we're talking about viral load. They reduce the viral load of the body, inside the body. By reducing the viral load, that's how the herbs coming in. For example, what we have here, sometimes we call like pilis, uh, turmeric, sap with honey. They put it in your forehead, and that's the absorption through the skin and to the body. And then they also have something like another part of it, something to eat, something to drink. They're boiling some herbs or some, I think, roots, certain plants that have antibacterial property, and drink it. By having that, actually, they reduce the replication of the virus. That's one way to do it, by reducing the pollutant and increasing the metabolic rate and increasing the immunity in the body. And that how they tackle in terms of virus, by increasing the immunity in the body, by reducing the metabolic rate, by reducing the replication of the virus. By doing that, the body can overcome of any virus infection. How do they do that? They do that during the drinks, especially when they are in people that are sick. They always say, take a chicken soup, take a honey, or some say are using habatus sauda, or they're using a lots of turmeric, that and a lot of fruits in order to upgrade or to uphold the immunity system, because those are the items in it. By doing that, they can balance up between the viral infection and the recovery. Those are the tactics that been using by the old medical professor last time. Ladies and gentlemen, I will talk to you again about on the third part, how we can replicate the same system, the same methodology um, of their medicine treatment, that we can use it in our daily life to hide, to really look at the COVID-19, specific for COVID-19 right now. Okay, see you again on my third channel. So thank you very much, and hopefully I can see you for the next video.